please do so. We'll go ahead and get started in a second.
Yeah, I'm sorry. Let me add into that. Also, sorry to interrupt you, but also on KION, their website should also be streaming it, just to let folks know.
Great. Why don't we go ahead and get started? Our guest of honor should be joining us shortly. Good evening, everybody. I'm Elsa Jimenez, the director of the Monterey County Health Department. Before you should see an agenda. I wanted to first let you know that if we do have Spanish interpretation, so las personas que están en audiencia, si desean escuchar esta plática en español, por favor oprima el globo al bajo de su página y lo mandaremos al canal de español en cual puede recibir la información en español. So nada más oprima el globo y seleccione español. So good evening, everybody. I want to introduce our speakers today. Thank you, everybody, for making some time to be able to get an update on Monterey County's current vaccine planning efforts. We are very excited to be at this point in time where we are able to vaccinate individuals. It definitely brings a light of hope at the end of the tunnel as this pandemic has been with us for over 10 months. Today, we will start off with a welcome by our new chair of our Board of Supervisors, Chair Wendy Askew. Following Chair Askew, we will have Dr. Ed Moreno, who is our Health Officer and Director of Public Health, as well as Christy Nishi, who is our Assistant Director of Public Health, provide an overview on our local vaccine planning efforts. Following that, I will help moderate a question and answer session. I do want to thank everybody who took the time to submit a question in advance. We received over 200 questions, and I understand that questions are still coming through. And I hope that this hour today helps to provide answers to some of those questions. If not, we will be sure to do our effort to circle back and post the answers to questions on our website. We will also be posting this recording, as you can see on the agenda, and we'll make sure that that's on the Monterey County COVID.org page. And then in conclusion, our County Administrative Officer, Charles McKee, will make some comments. So again, I want to thank everybody for taking the time and coming to our first town hall on our local vaccine planning efforts. And with that, I'm going to hand it over to Chair Askew.
Thank you, Elsa Jimenez. Thank you for having me. And to everyone who's on the call, my name is Wendy Root Askew. I was sworn into the Monterey County Board of Supervisors last Tuesday, and we are hitting the ground running. So on behalf of the County Board of Supervisors, I would like to welcome you to this virtual town hall where we will have an opportunity to learn more about the COVID vaccine. As the mother of a young child who has been doing distance learning since March, and sheltered in place with my mother, who falls into a high-risk category, I can share that my personal experience of this pandemic has been exceptionally challenging for many reasons. We are all so excited that the vaccine has finally arrived, but need to remember that we still have a long road ahead of us before anything will return to normal. I want you to know that I hear you and I see the urgency that you are telling us you have for information about the status of testing, about when and where to get your vaccines, and about the recovery efforts that will follow. We're listening. Please keep telling us what you need to know, and we'll do our best to get you the information. I want to thank you again for your commitment to learning more about the COVID vaccine tonight, and thank you again for your time. And again, remind you that we are here to provide this information and we'll continue to find ways to communicate with you in the languages that you speak, in the locations where you access your information. Thank you.
Thank you for that warm welcome, Chair Askew. I would like to let you know again that we are streaming this on our county Facebook as well as KO and YouTube. If people are trying to get on, please let them know that we are trying to make other means available. Again, just goes to show the great interest on this very important topic here today. With that, let's go ahead and introduce Dr. Ed Moreno, who's our Health Officer and Director of Public Health, to begin to share with us an update on our local vaccine planning efforts. Dr. Moreno?
Yeah, thank you, Elsa. Can you see my screen?
Yes, we can.
Okay, great.
You might want to move it to, there, you move it to presentation mode. Thank you, that's great.
All right, well, thank you, Elsa. Thank you for the introduction. Thank you, Chair Rudascu. Good evening, everybody. My name is Ed Moreno. I'm the Monterey County Health Officer and Director of Public Health, and I've been asked to give some information about COVID-19 vaccine. So I'm going to give a little bit of an overview to begin about the vaccine itself, how it works. The vaccine help our bodies develop immunity to the viruses that cause COVID-19, and does so without us having to actually get sick from the virus itself. So after a vaccination, a person's body creates special cells that remember how to fight off the virus in the future if they are exposed to the actual COVID-19 virus. It usually takes a few weeks for a person's body to produce these special cells. And I just want people to understand that if a person gets exposed to COVID-19 around the time they get their first shot, they might have some immunity to fight off the actual virus, but they don't have full immunity, so they might still get sick. So it's still important to practice safe distancing, social distancing, face covering, washing your hands, and staying home while you're in the process of getting fully vaccinated. There are different vaccine types. They are either messenger RNA, protein subunit, or vector. I won't get into these second and third types, but I do want to talk about messenger RNA because the two vaccines that are under emergency use authorization are Pfizer and Moderna, and they are messenger RNA type of viruses. So the Pfizer and Moderna manufactures the vaccine by creating RNA. They don't take the virus RNA, they create the RNA and put it into the virus. It looks very similar to the RNA, the molecule that the virus has, but it's not the same molecule. And then that RNA in the vaccine, when it's injected, a person will begin to produce something that's like the spike protein. It's a part of the virus, but again, it's not the virus itself. But the body thinks it is the virus. And so the body starts to develop, trigger its immune system to create these new immune cells that can fight off the actual virus should a person get exposed to it. And the vaccine trials that led up to the FDA approving, giving authorization show that 2 weeks after the second dose, the vaccines are 95% efficacious in preventing COVID-19. All right, there is a series for these vaccines. Some of the vaccines that are still in trials might require 1 dose. These two vaccines require 2 doses. If someone receives the Pfizer vaccine, their second dose is due 21 days later. If a person receives the Moderna vaccine, the second dose is due 28 days later. And the FDA says that if you get a Pfizer vaccine, your second dose must be a Pfizer vaccine and similar to the Moderna. All right, moving on to vaccine safety. Just want folks to know that there is a work group called the Western States Scientific Safety Review Work Group. It's separate from the federal level work groups. And they, as the vaccines were being reviewed by the FDA, they unanimously recommended that the Pfizer COVID-19 vaccine be used. And they also recommended that the Moderna vaccine be used. And they concluded that based on the trials, and they concluded that equity was considered appropriately in the clinical trials. I'll give you an example. They included individuals that represented a variety of ethnic backgrounds, racial ethnic backgrounds, for example, and gender. So they concluded that there was equity with that regard, and there was other considerations as well, not just that. And that they urged that we continue to look at trying to maintain equity as we move out through our implementation, monitoring, and communication plans for COVID-19 vaccine. There is also a California Scientific Safety Review Group, and the group reviews vaccine trials, evidence of safety, and other information. And they provide an independent recommendation to the state of California with regards to vaccine planning and to help ensure public confidence in the safety of the vaccine, that it's effective, and all of our efforts to implement vaccinations. There is information from both manufacturers on who should not receive the vaccine. So you should not receive the vaccine if you've had an allergic reaction to anything in the vaccine, or if you have allergic reaction to specific chemicals like PEG and polysorbate. And if you believe that you might have a contraindication of the vaccine, please check with your doctor. All right, there are some vaccine side effects. The most common side effects that you might experience include pain where you got the shot, also tiredness, headache, muscle pain, and chills. Those are the most common. And in the first dose, the side effects, any one of these side effects did not exceed 30% of individuals who received the vaccine. But the majority of people did not experience tiredness, headache, muscle pain, or chills. And even less common are joint pain, fever, swelling at the injection site, or feeling an upset stomach. But we need to let people know that there are possibility of side effects. All right, as regards to side effects, there are ways to report the side effects. It's important that the manufacturer and the Federal Drug Administration, who authorized these vaccines, receive feedback from the community, from people who got the vaccine, and from doctors who are administering the vaccine as to whether there were side effects. So I won't go through all this, but there's something called BeSafe. It's an app that the CDC has out there, and there's the link at the bottom. And this is use a smartphone-based tool where you can interact with the Centers for Disease Control and Prevention and report to them any side effects that you have. This is tremendously helpful for the CDC and the FDA to understand how this vaccine is being received by the community. There's also something called VaxText. This is a way for people whose provider does not have a way to send reminders for the second dose, where they can enroll and have a reminder when their second dose is due. And there is a long-established system where vaccine adverse events can be reported through a federal system, which we were using before the COVID pandemic. And a doctor who administers the vaccine, for example, can report through VAERS, or a person can actually go online and find the VAERS website and report that they had a side effect. All two ways to report side effects. So I'm going to transition now to vaccine allocations. So the ACIP, which is an advisory panel to the federal government and our own California Department of Public Health, has recommended a phased approach. And there are 3 goals particularly in mind. One is to decrease death and serious illness as much as possible as we roll through the phases. Also, we want to preserve functioning of society. An example of that is making sure that our healthcare workers receive the vaccine first, so that they are available to help any one of us who need hospital care or care from our doctors, and to reduce the burden that COVID-19 is having on people who are already facing disparities, facing struggles in their lives. There is a scientific review and allocation recommendation that came from the ACIP and a California drafting guidelines worker and California Vaccine Community Advisory Committee. So these are 3 organizations that have been guiding California Department of Public Health and also local health departments on how to most effectively and equitably get vaccine out to our communities. Now moving on to the California COVID-19 vaccine plan. I mentioned that we are working through phases, and we're currently in phase 1A. Pardon me, there we go. Tier 1 includes hospitals, includes skilled nursing facilities, paramedics, emergency medicine technicians, our dialysis center staff, and people who are residing in mental health facilities. So we are in progress vaccinating most of these people. We are still working on vaccinating some of these people who work on the inpatient settings. There's also tier 2, and we moved into tier 2, and we are very close to having a targeted approach to people who work in home supportive services, but we've already vaccinated some community health workers, some public health field staff, and many of our primary care clinics, including our federally qualified health centers, are receiving vaccines. And finally, tier 3 includes our specialty clinics who are getting vaccinated now, and we're working to make sure that our laboratory workers, our dentists, and our pharmacists are all getting vaccinated. And we have alerted the mortuary funeral home directors on how to schedule appointments to get vaccinated. I want to point out that there's different strategies that we're using. One example is that organizations can receive vaccine directly from the 2 manufacturers and vaccinate their own staff. An example would be our hospitals and clinics who submitted orders and received vaccine and are vaccinating their own staff. A second strategy is for organizations to receive vaccine from our department, and then they go and vaccinate their own staff. So Soledad Medical Group is an example of a group that received vaccine from us, but they took it and they vaccinate their own staff. Another strategy is that we can actually bring our vaccine that we received over to an organization. We continue to have the vaccine under our custody, but we observe as they vaccinate their own staff. One example was a couple weeks ago where Monterey Fire used our vaccine to vaccinate, and anything that was left over, we would have taken back to our department. And another strategy is that we conduct our own, what they're called closed points of dispensing, that are only available to staff of specified organizations. And the best example is the very first clinic that we put on out in the community, which targeted Mercy Medical, EMTs, paramedics, and actually people who are going to be vaccinating other people. So these are just a few examples of strategies. We need to make sure that we develop the strategies most appropriate for the group that we're trying to vaccinate with the vaccine that we have. This is just an example of the point of distribution that we had at CSUMB. And we had fire and paramedics with fire and vaccinators attend the clinic to get vaccinated. All right, there are other phases, phase 1B, tier 1, and phase 1B, tier 2. In tier 1, we were instructed and guided by the state to vaccinate, when we get there, individuals 75 years of age and older. And as of yesterday, the state has recommended that that be reduced down to 65 and older for phase 1B in tier 1. There hasn't been any changes that I'm aware of as of tonight in the rest of phase 1B tier 1, which are educators, childcare, emergency services, and food and ag individuals who are at risk of exposure while they're working. And we will eventually get to tier 2 and tier, and tier 1C. So there are some specific strategies that we want to use here in phase 1B. One is an organizational approach, and in this strategy, we vaccinate individuals based on their affiliation with an organization, and requires us to identify organizations with staff who are eligible for a vaccine, establish points of contact with that organization. We quantify how many individuals in those organizations can receive the vaccine through surveys, for example, and then we develop mechanisms to communicate how these individuals can schedule a vaccine appointment. We can also use large-scale points of distribution, which I previously described. In this case, we have to identify locations that accommodate a high throughput of vehicles, a lot more people. We also need to focus on locations that routinely host large-scale events because of the issue with traffic coming and leaving. And also we need to secure and dedicate an adequate amount of vaccine supply so that when people make an appointment at a large clinic, they will get the vaccine that they signed up for. Another phase 1B strategy is on-site vaccination. That's where someone brings the vaccine and the vaccinators to individuals eligible for vaccination. So they don't have to go get the vaccine, it comes to them. So this is where we need to identify organizations that have people can get vaccinated. We have points of contact as well. We need to quantify how many people so we can plan appropriately and how we're going to communicate. So examples here are the CVS and Walgreens pharmacies, which are currently vaccinating individuals and workers at skilled nursing facilities. So the residents can stay at the skilled nursing facility where they live or where they reside, and pharmacies will bring the vaccine to them. And then one more strategy is a provider vaccination strategy. This is where we vaccinate individuals at their existing health provider locations. So very similar requirements for this as well, but the clinics need to figure out how to communicate to their patients how to schedule a vaccination appointment. So examples are our primary care providers and our pharmacies and private organizations who already have experience vaccinating for influenza in community clinics. All right, here's phase 1C, which includes, for now, individuals 50 to 64 and people below that age with underlying medical conditions and other essential workers. And this just depicts how we're currently in phase 1A, and we'll be moving into phase 1B, eventually 1C, and then finally phase 2, where everyone 16 or 18 and older can get vaccinated. This is where I just want to show that we are in the process of looking at how to keep track of where vaccine has been delivered and how much has been administered. So this, I won't go through this, but you can see the variety of different organizations who have already received vaccine and about how much they've received. And then we can go into the immunization registry, because every one of these vaccines that get administered has to be entered into California Immunization Registry. Once it's entered, we can go into the system and look. These numbers without parentheses are currently what's showing up, even though Natividad has 1, Doctors on Duty has 0. However, I have contacted individuals from there, and I know that at least 30 doses at Doctors on Duty have been given, and almost 3,000 doses at Natividad Medical Center have been given. So this just points out that there are some limitations to the state's immunization registry when it comes to trying to track how many vaccines have actually been given. All right, we do have another mechanism to get, I'm sorry, this is one of the mechanisms that I mentioned earlier, the retail pharmacy partnership, where the Walgreens and CVS go out to our long-term care facilities. And we have at least 11, I know we have more than 11 skilled nursing facilities in Monterey County. We have clinics scheduled, and many of them have already been vaccinated. Our website has a lot of useful information. This is one where we have, besides information, common questions answered up here, but this is a part of a table that we have that goes through the tiers and informs the public what the status is for each group in each tier on that right column. This is a very simple sheet that we're using through social media and on our website, where people can quickly look to see where we're at. Anyone who is a healthcare worker in any of these organizations, if you haven't been notified, please call your employer and ask if they have information, if they've received information yet from us on how the employees can sign up to get vaccinated. And we also have that in other languages. This is in Spanish. And that's it, Elsa. I'll be available for questions.
Great, thank you for that, Dr. Moreno. We have quite a few questions that have come in advance of the town hall and that are also coming in through Facebook. So thank you, Chair Askew, for letting me know of those, as well as through the current Zoom. So as you can imagine, the most important question in people's minds is, when will it be my turn to get vaccinated? I think the announcement of the governor yesterday regarding inclusion of 60, or the day before, inclusion of 65 and over, when specifically will the 65 and older be able to get vaccinated?
Sure, thank you, Elsa. So we do have a vaccine that we received in the health department. And I can share with you that almost every vaccine that we have in our refrigerators has been dedicated to an appointment for someone to receive. So when this announcement came out, we had already dedicated all our vaccines. So what we're going to have to do is look at future allocations that the state makes to us, and we'll have to look at whether or not we've been able to vaccinate our healthcare workers sufficiently. And when we feel that we've been able to vaccinate healthcare workers efficiently, we would very much want to move into individuals that are 65 years and older or older. But as of it right now, speaking from the health department and our vaccine, right now with all of the clinics that we scheduled for the next week and a half, 2 weeks, have already been, our vaccine's already dedicated to that. So hopefully in the next few weeks, hopefully very soon, the health department will be able to work to get people who are 65 years and older, hopefully sooner.
Great, thank you for that. So we also have some questions coming in regarding individuals are actually identifying themselves as being in phase 1A, tiers 1, 2, and 3. They might be healthcare workers in small practices, and they have not been notified of availability of for them to be able to make an appointment. Can you please just stress again what it is that they should be doing to ensure that an appointment is made available to them if they are in this first phase 1A?
Yeah, certainly, Elsa. So for many, many years, we've encouraged healthcare providers to give us contact information so that we can notify them through health advisories and health updates of immediate issues that require their attention or issues that require them to take action. So we have been reaching out through many healthcare providers through that mechanism. Of course, there'll be people who aren't on that list or have chosen not to be on the list for whatever reason. We do encourage them to contact us and be added to the list. I see Christy Mishi's on the line, and she is has been very involved with notifications that are going out. So maybe Christy could add a little bit to that answer.
All right, so good afternoon or evening. We have been sending these health alerts and health advisories out. If you are not receiving those, you can contact the health department and ask to be added to the list. Your clinic can be added to the list. In the meantime, those health advisories and alerts are posted on our website, on the COVID-19 website, under health alerts and advisories, and also in information for medical providers. In those health alerts and advisories is a web link that you can use to submit your practice's information to the health department, including a contact person for your practice and the number of individuals that you have that need to be vaccinated that fall into phase 1A, tiers 1, 2, and 3. Then when we have available slots, someone from the health department will send an email to that contact person, giving them further instructions on how they can enroll in a healthcare provider-focused clinic.
Thank you for that, Christy. Dr. Moreno, some individuals inadvertently received an invitation to be able to schedule a vaccine earlier this week that was really intended for people in phase 1A. Some people adhered to canceling that because they were not in that phase. So the question is, does that mean then that those slots went unused and that vaccine was wasted?
So first of all, we haven't wasted any vaccine due to scheduling, so that's fortunate, and we hope that continues. In terms of, in general, if there are any open slots in our vaccine clinics, our vaccine coordinators and planners do their best to notify individuals and groups or employers that have people who should be getting vaccinated, and letting them know that we still have open slots. And so with that particular day when people, and thank you for the people who realized that that information that went out was not sent out appropriately, that opened up some slots for individuals. And we fortunately, in those circumstances and moving forward, will continue to notify other individuals and let them know that we still have vacant slots. Please sign up and get here as soon as you can to get vaccinated.
Thank you for that. There was also some information that may have been made available over the weekend regarding expansion of professions eligible in phase 1A, including veterinarians and staff working in veterinary clinics. Do you know if that was an official change by the state regarding adding this profession, or what may have happened with that?
Yeah, thanks, Elsa. So with regards to healthcare providers, the state does have, I believe, has a list of who is considered an essential worker in the healthcare sector. I think part of that comes from the federal government. But what we look at is guidance that comes out specifically from the California Department of Public Health. And currently, we haven't either heard directly through conference calls, or I haven't heard directly from conference calls, or seen any written direction from the state that to include veterinarians. And there are some other healthcare sector essential service groups that the state hasn't yet added to phase 1A, but we do recognize that veterinarians and others are very important, and we really do hope to get to those groups as soon as possible.
Thank you for that. So do we know how many Monterey County residents are in phase 1A, tiers 1, 2, and 3?
Very good question. The state, for the purposes of allocating vaccine to all the counties, conducted research to estimate how many healthcare workers are in each county. And the state of California determined that, or estimated that there were 22,000 healthcare workers in Monterey County. And that's what they used to divide up the vaccines to the different counties. So that's the number that they're using. One of the things that we have been asking, though, is from healthcare employers is to go to our portal and enter information about the organization, so that from on a day-to-day, week-to-week basis, we have an estimate of how many folks are needing vaccine, and we match that with how much vaccine we have. And when we feel that we have enough vaccine to invite a group, then we will send that information out to that group and say it's time to make appointments for your employees to make appointments, because we have enough vaccine for another clinic. So the big picture is 22,000, but when it comes down to it on a day-to-day, week-to-week basis, we're working slowly, we're carefully moving through each of the groups and each of the tiers to make sure that when someone goes online to make an appointment, there's a good chance there's going to be an appointment available. What we don't want to do is to schedule so many appointments, more appointments than we have vaccine for, and then people, unfortunately, that could lead into significant challenges where people are expecting to get a vaccine at an appointment, and unfortunately, we might not have the vaccine when the time comes. So we really want to avoid that. So we're carefully moving forward in releasing information about clinics. As long as we have the vaccine, we will continue to release information about clinics to various groups.
Great, thank you. So it sounds like we have about 22,000 individuals that are eligible in phase 1A, tiers 1, 2, and 3. Can you remind us again how many vaccine doses have been distributed to the county, and your estimate on how many of those have actually been administered?
Sure. So we have 24,000 as of earlier this week, 24,150 doses that the state has allocated to us. And I'm happy to say that in partnership with these organizations that can order directly, and other organizations that can't order directly but have agreed to help vaccinate, we've been able to, the state has approved all the orders. And so this allocation, we've been able to order and get all this vaccine to us. We haven't let any vaccine go to another county. So I'm happy to say that. Over here on the right, I can give a little more details, certainly. We can see that, as I mentioned, there are some providers like Doctors on Duty and Natividad where we don't see the really any vaccines being given. But I did contact the leadership in these organizations. So in parentheses, this is what they're saying that they vaccinated, how many vaccines have been given, excuse me. So not counting the calls I made, just looking at what's in the immunization registry, we have 10,742 doses that have been administered in Monterey County. We may or may not be able to add almost another 33,000 doses, but we'll have to continue to work with the state and their care system. But it's possible that Natividad's 3,000 would add to that, which would get us closer to 14,000 doses having been administered. A lot of these are first doses. Some of them are second doses. So this doesn't mean that 10,000 people have been vaccinated. It means that 10,000 vaccines have been administered, because some people have received 2 doses.
Great, thank you. I was going to ask a follow-up on that. So if we estimate there's approximately 22,000 individuals eligible under phase 1, and we've received approximately 24,000 doses, and the vaccines require 2 doses. So really to date, we've only been distributed enough to maybe vaccinate about 12,000 individuals. in this first phase?
I don't know that we could, it's a very good question. I don't know that we're prepared to answer that question tonight, Elsa, but I can tell you that many of our providers have been very active in immunizing their own staff, but also offering vaccine to people outside of their healthcare organizations. One more thing I'd just like to share is that we're also looking at how much vaccine Monterey County Health Department has received, approximately 6,000 doses, but the care system is only showing 834 doses. However, we know that we've administered much more than that, and just about any vaccine that we haven't administered yet is already, as I mentioned, dedicated to appointments for people to receive. So although we do have some vaccine at the health department, it's already been dedicated to someone's appointment.
Great. And you said that we have currently scheduled appointments for the next couple of weeks based on vaccine available to us already?
That's right. So we have moving into the rest of this weekend and part of next week, I believe we have, we continue to have first dose vaccine clinics, but moving into a week and a half, 2 weeks from now, we're going to also be having some second dose vaccine clinics for those, for example, the paramedics and the EMTs who were the first to get the vaccine in our clinic. They've been notified already. Before they left, they were notified when their next dose was due, and we've got clinics scheduled for them as well.
And then if I'm going to shift a little bit into talking a little bit more about the vaccine. So once you've been vaccinated, are you still able to, are you safe? Are you protected? Or if you are exposed, will you get COVID and then be able to pass it on?
That's a very good question, Elsa. And what I can, oh, excuse me, one moment. Okay. What we know about the vaccine through the trials is that among a group of people who've been vaccinated, when you compare people who've been vaccinated to people who don't get vaccinated, many more people who don't get vaccinated go on to get the actual disease and can become very sick. But the group of people who got vaccinated in the trials, very few of them actually got symptoms. And it was a significant difference. And so what we can say is that the vaccine prevents COVID illness. What researchers are now looking at is now that we have many more people vaccinated, what researchers will be looking at is to determine whether or not it also prevents transmission. So we know it prevents disease, but there is a concern that the people who are protected because of the vaccine may still get exposed to COVID-19 virus and might be able to spread it to somebody else. So what do we do in the meantime? People who've gotten one or two doses of one of the COVID vaccines must still wash their hands, keep their distance, use face coverings, and stay home, because there might be a chance that people who feel great because they got the vaccine, they don't get any symptoms, might get exposed and turn around and expose somebody else. So until the research is done, we're still all going to need to continue to wear face coverings, keep our distance, wash our hands, and stay home.
Great, thank you. Now, if you are a pregnant woman or you are a lactating woman, you're breastfeeding your child, should you get the COVID vaccine?
What I can share, Elsa, is what the FDA authorized, and the FDA authorized the vaccines. Depending on the vaccine, it's for people 18 or 16 and older. And they did not, the authorization did not say that pregnant women or women who are nursing should not receive the vaccine. So pregnant women and women who are nursing are included in the group of people who should get the vaccine.
Can you expand a little bit on there? Are there any medical conditions that would preclude someone from being able to get the vaccine?
There are some. They're not necessarily medical conditions also, but there are individuals who they and their healthcare provider know that they have allergic reactions to some of the components of these vaccines. And so that in those situations, they need to talk to their doctor to determine whether or not they can get the vaccine. And if they have severe allergic reactions to ingredients in these vaccines, they should not get the vaccine.
So it sounds like a good action item that individuals over 65 years of age or who are in an upcoming tier and are concerned, they should be reaching out to their primary care provider to discuss their concerns. That way, when they are eligible for the vaccine, they're ready to register and sign up and accept the vaccine if that is the decision they choose for themselves.
I agree with you, Elsa. I think that there's been a lot of emphasis on public health and some agencies to provide many of the information and services to people who are concerned about COVID-19, whether it's testing, case investigation, and now vaccinations. But I really want people to remember that those of you that have primary care providers, that those of you that have a healthcare home, your doctors are also, and your providers are also a good source of information for a lot of the questions that you have. And I think that people should take full advantage of an opportunity to talk to the healthcare provider, because the healthcare provider can give medical advice that's specific to a patient.
Mm-hmm. Great, thank you for that. So let's say we open up a vial and have a few doses left. What happens to those additional doses in that vial and you're done for the day? You know, you've taken your last appointment at the clinic.
Mm-hmm. Well, Elsa, I think I have a pretty good idea what happens, but Christy's been waiting here patiently and she has so much information to share. Let's see if Christy can answer this one.
So first of all, our clinics are very carefully planned so that we take into account both the doses that are listed as what's going to be coming out of the vial, but the doses that we know that we think reliably we're going to get out of the vial. So what I mean by that is there's been a lot of reports of extra doses coming out of the vials. You know, instead of 5 doses out of a vial, there's 6 doses out of a vial. So when we plan our clinics, we do take that into consideration that we are going to get extra doses out of our vials. So we have very, very few instances where we have extra doses at our clinics. When we do reach out to individuals who we know can provide us with people who need to be vaccinated very quickly and fall into the same tier so that we can get them vaccinated and not let any vaccine go to waste. Our immunization coordinator, if any of you had worked with her, is very aggressive about making sure that no vaccine goes to waste.
Great, thank you for that. Can you speak to what's happening at the hospitals and the clinics? You know, are they also following the same guidance in terms of just making sure that everything is coordinated and planned so that we eliminate waste to the extent possible?
Well, yes, thank you, Elsa. So I think that fortunately our hospitals and our healthcare clinics, such as the county clinics or Clinica, have years and years of experience of immunizing large numbers of people for influenza every flu season. So a lot of those strategies, a lot of those protocols have been modified for the COVID vaccine. So they each also have vaccine coordinators, same role that our vaccine coordinator has, who have tremendous amount of experience and undergo regular training and retraining and certification to make sure that there's proper oversight of vaccine at all these facilities. Unfortunately, despite all of our planning, all of our training, all of our certification and drills that we do, sometimes things will happen. Sometimes refrigerators will fail. Sometimes freezers will fail. So we have backups. We have monitors that are we call data loggers that track the temperature of these refrigerators and freezers. And if it goes too high or too low, the temperature goes too high or too low, alarms go off, and we implement our plans to quickly as possible move that vaccine to a backup refrigerator, a backup freezer as quickly as possible. And then we notify, if we follow protocols, and if necessary, we notify the manufacturer, tell them what happened, and work with the state to determine whether or not we can still use that vaccine, because we don't want to give people vaccine that doesn't work anymore because it went out of temperature for too long. So it would be better to acknowledge that some vaccine is no longer good than to give it to someone and they think that it's going to work. So we have these protocols in place. We will work with the manufacturer, just like the vaccine coordinators at our healthcare facilities, clinics, and hospitals, to make sure that we only give vaccine that's going to work.
Great. So Christy, you mentioned previously that people can call the health department if they are part of a small healthcare practice. What number should they be calling? And then if people want more information or to be notified when they may be, when they're the tier that they're in is upcoming, how could they submit that inquiry into us, and what's our process for responding? And I'm sorry if I caught you off guard, I can come back to you.
You caught me off guard, and our PIOs on this call are going to be very upset with me because I can't remember the COVID-19 call center line. So somebody will have to help me out with that. But I would suggest that they call the COVID-19 call center here at the health department, and they can speak with someone who can give them the information.
And I hope I'm not misspeaking, but I think it's 769-8700. I'm hoping that our PIOs will tell me if I've misinformed. So again, 769-8700. We also have a means of filling out a form. Do you want to let people know where that is?
Yes, it's on our COVID-19 website. Our public information officer keeps that very prominent on our website. It's the Monterey County COVID-19.com. We'll get you to the landing page where you can find that link to be able to submit your interest in being vaccinated. This works for employers who are know that they're coming in subsequent tiers and want to provide us with information about how to contact them, who's the point of contact in their business, and how many individuals they might have that need to be vaccinated, and what their industry sector is. It also does work for private individuals as well, who feel that they may be falling into a tier that's coming up and want to provide us with a way to get a hold of them and share information about the tiers and vaccination as it moves forward.
Great, and I think we'll make sure that that information is embedded in multiple places on our website to make sure that people have the right number, and then an ability to be able to submit an inquiry. Can you remind us again how the invitation will come, and where will people be able to go get vaccinated, particularly as we move into phase 1B, which includes individuals over the age of 65 and those that are at risk of exposure in the education and childcare setting, emergency services, food and agriculture? How will individuals in those sectors be notified, and who are all the entities that will be able to make the vaccine available to them?
Christy, can you answer that one?
Okay, there's a lot of questions there, so I'll try to get them all. So I think we've seen recently how well information passes on social media. We'll be using our media releases. We'll be getting information out through radio, through TV, but also through social media, keeping people informed about what tiers are moving forward and how they can be vaccinated. You know, we're going to try to keep everybody as informed as possible to let them know when their turn is coming. We're keeping our website up to date, so it's important to keep checking the website. If you follow us on Facebook or social media through Twitter, that's another way to make sure that you're staying informed about what's happening. When it's time to be vaccinated, the process will be that what may be a different way depending on where we are in the sector. So it could be that your medical provider reaches out to you and says that they're ready to vaccinate you, and you have there's vaccine available at their clinic. It could be that we provide a link through our media that you can register for a clinic. So there's a couple of different options of way that might happen. In terms of who is vaccinating, we have several partners that have agreed to work with us to vaccinate. I'm not sure if you're asking about the actual vaccinating people or the people who are helping us with the clinics.
Let me help clarify. So people are wondering why the Visiting Nurses Association, for example, isn't vaccinating yet. You know, will small provider practices be vaccinating their own patients, or is there another venue that individuals over 65 years of age, for example, should be going. And why don't we have these large mass vaccinations set up like people are seeing on the media in San Diego, for example?
Okay, so we are working with a variety of organizations. We do have a relationship with Visiting Nurses Association. We contract with them to provide you all with flu vaccine every year. We'll utilize that structure as we move forward and need to vaccinate more individuals, have the tiers be larger. So that's one way. Our hospital partners have stepped up and provided vaccination services. So have many of our urgent care centers. So we'll have a variety of individuals. We're working with nursing schools. So some of our nursing students have been very anxious to come forward and help provide vaccination services. So we'll be working with those. Our EMTs have received special permission to vaccinate individuals. So our EMTs will be working to make sure that some of our public safety officers will be vaccinated in the future, as well as firefighters and some of our other critical infrastructure workers as we move forward into the appropriate tiers.
Thank you.
And also, the only thing I would also add is that we have been working with VNA very closely. They're a great partner. They are, on our behalf, they have been out in the community conducting testing, going from site location to location, community to community. So they are they're currently testing, and we very much appreciate them doing COVID testing. But our agreement with VNA also includes vaccinations. So as Christy mentioned, they are one of a growing number of vaccinators in Monterey County, and we very much look forward to a point where they can begin to focus more on vaccinating.
Great, thank you. Let me ask you a little bit about the process for individuals who are either private home healthcare workers or in-home supportive service workers. How will this critical workforce be notified that they are able to schedule an appointment? You know, this is a group that is in current phase 1A, tiers 1, 2, and 3.
So I believe, Christy, we have information on our website where healthcare workers in tier 1, 2, and 3 can go to get information on how to sign up for clinics. Am I correct?
Yes, they can use the link in the health advisories for medical providers to provide us with their contact information so we can reach out to them.
Great. Thank you for that. So at these pods, which, can you tell us what a pod is?
Christy, would you like me to do that? Or would you like to, or I could start, how's that? Okay, appointed distribution is a term that was developed long ago for vaccination clinics in the community. And so appointed distribution is basically a closed pod or open pod. A closed pod means that we are targeting a specific group. When we vaccinated out at first vaccine clinic at CSUMB, that was a closed pod. That was specifically targeting EMTs, paramedics, and anyone that was considered a vaccinator who was going to assist in vaccinating other people. That's a closed pod. Open pod is more open and available to other people and not so targeted. So those are different types of pods. The pod itself, when you arrive, what you'll notice is that there is, as soon as you get there, there is control of either pedestrians or cars. And there are cones and arrows and directions on where to go. So there's immediately control of the folks keeping distance from one another. And then when you check in, that someone will check to make sure that you have your appointment, that you can verify the appointment, and as necessary, depending on the pod, evidence that you are an employee in that particular sector in healthcare. And then people will be checked to make sure that they don't have symptoms of COVID, which include fever. And if they do, they will instruct them that they need to reschedule because we don't want people who have symptoms of COVID coming into our clinic sites. Someone who gets, the next step is to move on to to learn about the vaccines they're getting. So the information about what they're getting, make sure there's a reason why they shouldn't get the vaccine, and also information. We try to give them information about VacSafe, which is VSafe, which is a way that they can share information about their side effects should they get the side effects. Then they would move on to get their vaccine. They'll be checked one more time with our vaccinators, and they will receive their vaccine. From there, they are asked to wait for 15 minutes while one of our, in the last case, the last clinic I went to, we had one of our public health nurses who had people wait, timed everybody, checked them for symptoms, and made sure that they did not have any anaphylactic severe allergic reactions before they were allowed to leave. If they do have reaction, our staff are trained on how to respond to someone who's exhibiting or feels that they're having anaphylactic or severe allergic reaction, and we can monitor them and assist them and get, if they feel they need higher level of care, we can assist them in going through 911 and getting them transported as quickly as possible to an emergency department that can fully assess their symptoms. So that's what someone can expect if they go to a pod clinic that we're putting on. The hospitals have other modifications to something like that, but they tend to be very similar. And I'll stop there. I don't want to speak on behalf of the hospitals. I'll see if Christy has anything else you'd like folks on the call to understand.
Well, the only thing I realized while you were explaining very well what a pod is, that I didn't really answer Elsa's question about why we hadn't stood up these very, very large pods that you see on TV in Southern California. And the simple reason for right now is that we don't have enough vaccine to do that. Those clinics require thousands and thousands of doses every day to be administered, and we just don't have that volume yet in Monterey County. We're hoping that as more vaccine becomes available, that we will be able to offer much larger clinics, what we call mass vaccination pods here in Monterey County, and we are in the planning stages for trying to develop plans and sites to be able to do those. So more to come. We're hoping that we'll have some of those in the future. We just don't have the vaccine now to get them to do them.
Thank you for answering that, Christy, because that was going to be my follow-up question when we were describing the pod situation. And thank you, Dr. Moreno, for assuring that these clinics will have the medical personnel needed to be able to address any reactions that an individual may experience after receiving the vaccine. We only have a couple of minutes left, and yes.
One thing, if a person knows that they've had an anaphylactic reaction in the past, but not because of ingredients in the vaccine to something else, egg, peanuts, for example, we do recommend that if they have an epinephrine pen, that they bring it with them, just in case. And we did find that people who have had those reactions in the past knew what to do ahead of time when they brought them. So that would be my one recommendation.
Great, thank you. Just, I think a couple more, because there's a lot of these kinds of questions coming in. If you don't live in the county full-time, but live here part-time, are you eligible to get your vaccine here? Or let's say you live in Santa Cruz County, but work here full-time, where should you be getting your vaccine?
Christy, can you respond to that?
Yeah, so if you live in Monterey County part-time and you fall into one of the tiers to be vaccinated, you're welcome to get vaccinated in Monterey County. If you are a healthcare worker, say for instance, who works at Natividad Medical Center, but you live in Santa Cruz County or San Benito County, you are welcome to get vaccinated in Monterey County.
Great, thank you for clarifying that. Can we talk just maybe a minute or so on schools? So individuals in school settings and childcare are in phase 1B, tier 1. And there's also a strong message from the state regarding beginning a process for resuming in-person instruction. Should teachers be vaccinated before in-person instruction resumes? Are you able to answer that question?
I will start to answer, but first I would say that I'm still reviewing the guidance that came out from the state, and I need to spend more time with that guidance to more fully understand it. And I may call the state for clarification. But from what I can tell right now, the criteria for reopening schools under the new guidance are not related to vaccine status. I think there is still some recommendations or requirements for testing, though. And I know that the state is putting a tremendous amount of time and effort and resources into making testing or screening of staff and I believe students as well, and making it one of their priorities in working with the OptumServe, the company OptumServe, and also the state's new laboratory down in Valencia, California. So I will need to continue to read more about, fully understand the guidance. But again, fortunately we have Christy here. She might have a little more information to share.
No, I'm sorry, I don't have anything additional at this time to add to that.
Great. I do want to let the public know that I may not have asked your question exactly how you asked it. I tried to group based on theme, and we may not be able to answer your specific question, but we will be grouping questions again based on theme and be able to provide a response to that. And all that information will be on our website by next week. Before I hand it over to our CAO to provide some closing comments, really the most critical question that I see coming through is, can you give us any idea of when we will be confident that we have made the vaccine available to everybody in phase 1A so that we can progress into phase 1B? And then I have one more question after you answer that one.
Yeah, so thank you, Elsa. It's a question we commonly get. I understand that people want to have an idea. If they can get a specific date, even better. But as Christy has mentioned before, we don't have enough vaccine right now to vaccinate everyone in 1A. And we only know from week to week how much vaccine we're going to get for the entire county. So we can't, unfortunately, we can't provide any dates as regard to deadlines for moving on to 1B. However, I will share that the state has issued written guidance that encourages counties that have made significant progress in vaccinating people in 1A to then move into 1B, recognizing that there are some people in 1A who won't receive the vaccine or are hesitant right now, but will get it later. And so there will be some people in 1A that aren't getting the vaccine. So that shouldn't hold us up. If we've made significant progress, shouldn't hold us up from moving into 1B.
And I apologize, you made me think of a couple more questions. So if I'm in phase 1A and I'm not yet ready to receive the vaccine, will I have an opportunity at an upcoming clinic once we've moved past phase 1A to get vaccinated?
Thank you, Elsa. The quick answer is yes, but my response is if you're in 1A and you're a healthcare worker and you've been offered the vaccine, take advantage of the opportunity to get vaccinated. We have smaller clinics right now, and it should be easier to get into an appointment to get vaccinated. As we move into 1B and you decide later that you want to get vaccinated, we're going to have much larger clinics. Hopefully we can accommodate you, but do it now while the opportunity is there.
Great. And then one last question, I think. Phase 1B, are we going to do any prioritization in tier 1? In other words, are we going to prioritize those at risk of exposure because they're in one of the sectors identified over 65 and over? Are we going to prioritize 65 and over? Or really, what's our thinking behind how we're going to begin to make appointments available to people in phase 1B tier 1?
Yes, that's a really good question, a very informed question. So what I would say is, in response is that since we started vaccinating, we have done our best to follow state guidance, and we will continue to do our best to follow state guidance. The guidance was additional guidance was just released yesterday from the state of California, addressing prioritizations in 1B. So we just got that yesterday, and we will be reviewing that along with the school guidance. There's a lot coming out from the state, and we will review it. And I hope to have a better answer next time we have the opportunity to discuss this. But we will continue to do our best to follow state guidance.
Great. And then since CAO McKee only needs a couple seconds, I'm going to keep people on for another minute and ask you one last question. I promise, one last question. Can you remind us what the allocation methodology for vaccines is for the counties? And then let me qualifying. Our case rate is very high. Does that give us any priority over other counties in terms of making more vaccine available to our county.
So, okay, Elsa, so the allocation process in California, we're part of the national program. So the federal government, from what I understand, allocates vaccine to states based on population. And then some of that vaccine goes to the state to pass down to us. But before they give us vaccine, first the state has to give vaccine to the pharmacies to vaccinate long-term care facility residents and staff. Then they give vaccine to state facilities like state hospitals, state prisons, and other organizations that the state is responsible for. So there's different places where the vaccine goes. And after that's been allocated, then they look to see what's left, and that gets allocated to the counties. At that point, the state does have formulas that they use that are developed to try to take into account the disproportionately impacted communities in each of the counties, and overall disproportionately impacted counties, and using a formula that's derived to try to achieve equity in distribution, they allocate to the counties. So that's how they calculate it, and then we get our allocation. I hope that answers the question.
Great, thank you,
I can add one more thing. Once we're told how much we get early in the week, it might change by Thursday when we have to put Thursday evening we have to put our order in. But during that week, when we have an idea how much we're going to get, we are in communication with all the providers that have signed up to receive vaccine and working with them to identify additional groups that still need to be vaccinated, and encourage them to place orders and to continue to participate in our countywide campaign to vaccinate everyone in 1B so we can more quickly get to 1A, so we can more quickly get to 1A. Excuse me, 1B. Thanks.
Great, thank you for that. So I'm going to hand it over now to our CAO McKee to provide some closing comments.
Well, thank you, Elsa and Dr. Moreno. Elsa Jimenez, our Director of Health, Dr. Moreno, our Health Officer, and Christy Michi, our Assistant Director of Public Health. And before I make some final comments, I would like to ask Christy, one of the things that I heard her talk about was registering. People all want to register. And so if you could reiterate, can people register? What does it mean to register? And where can they register?
So I think that I haven't been using the word register. I think you can submit your interest in being vaccinated right now. And so there is a link on our website, and our PIOs will make sure that that's prominently displayed on our website so people have access to it. What that does is either whether you're a business, whether you're a healthcare provider or organization, or whether you're an individual, it allows you to go in and put your information in, and more importantly, your contact information, so that when we get to your tier, we'll be able to reach out to you and provide you specifically with information about where you can go to get vaccinated.
And so that's on the health department page, which is also linked to the county's overall web page, correct?
Yes. And our health department's COVID-19 website is MontereyCountyCovid19.com.
Thank you. I appreciate that, because I think that's something that people need to know is how do we make sure that we're in the system to get notified. So with that said, I want to thank all the panelists, obviously, but also all the people that have called it or sent in their questions. We know that there was a limit that was placed at 500, and that was tried to get exceeded quickly here on Zoom. So people were on Facebook and YouTube, and so we know we're going to have to do this again so that we can accommodate all those people that have been trying to get on, plus accommodate all the questions. One of the things that I've noticed about Monterey County, as you mentioned, Christy, is that everybody seems to be helpful. They're on various social media trying to get the information across to our community. And that's really important, because Monterey County is a great community that works together to try to solve these problems, such as the problem we have with COVID-19 and how we might get it resolved. But there are some people in Monterey County that are not tech savvy. They may be older. They may have issues with broadband or connectivity. And so as a community who does a lot for charity, I think it would be great if you now have a neighbor or a friend or a relative that for some reason isn't able to access the information that we're providing here, that you reach out to them to let them know some of the information that might be out there about how they can get vaccinated, and maybe even help them get to a vaccination site when the time comes, or at least connect them to resources that might get that vaccination to them. I think that's really important that we make sure that we're reaching all members of our community. And then finally, everyone knows, I think Dr. Moreno talked about it, is that we're obviously not done here. We need to recognize some of the good practices, healthcare practices that are important to help us get to the finish line, help us make sure that COVID-19, that we have the immunities to COVID-19 that make us all feel safe to go back to normal. Our hospitals are full. We know that. We don't want any of you having to have an issue and going to the hospital and don't have the resources available. So do what we've been telling, do what the healthcare professionals have been telling you. Wear your mask, wear your face covering, don't congregate with people outside of your household. Everybody knows all the ways to do it right now. And that'll help us to get to the finish line. And also thank those people who are out there working and helping us through this. Those might be grocery store clerks. They might be the clerk at the hardware store. Clearly, our nurses, our doctors, but also those who are cleaning the rooms in the hospitals, or those who are coming around to pick up your trash at the curb. They're working every day, and we should recognize those contributions to our community. We are a strong community. We will get through this, and we will get through it and be strong and be stronger at the end. I want to thank everybody, and I want to thank everybody for doing what is right. And we'll see you soon again.
Thank you, Charles. And if I may, I just want to remind the public that this was recorded, and the link to the full recording will be made available on our website. And as I mentioned, we will make every effort to answer your question. It may not be your question directly, but it will be grouped by themes. Again, just stressing the importance of continuing to do what we know helps to prevent further transmission of COVID. Stay home when you're sick, wear your face covering when you're outside of your home, and stay physically distanced. And again, if you receive an invitation and you are eligible for the vaccine, as Dr. Moreno said, get vaccinated. So thank you again, and have a good